Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
So we have been very fortunate because we have such fantastic exhibitors at our Boomer Expo, which is happening on Tuesday, July the 25th, and over there at Seminole Casino. And we have a lot of interesting people. And right now we're going to hear from Roberto Bertran, who's a sales executive with Medicare, Coventry Health Care. Welcome to our show, Roberto.
Thank you for having me, Anita.
Yeah, we had a little discussion before that. He told me he was from Cuba, and I told him how I lived in Miami, and I remember in 1959 when the Cubans first came on all different ways, but they got there. And today, Miami is a different place because of the Cubans.
Thank you.
Yeah, I really, now we have Latin America come from everywhere, but that time that wasn't happening.
Correct.
But the Cubans came and they loved it, and they had a very, in fact, I remember my in-laws had efficiency apartments and 4 people living in an efficiency apartment. We brought in beds, and these were very well-educated people. Mm-hmm. And it was glorious to see.
I remember those times.
It was so beautiful. I learned to speak Spanish. I mean, I'd studied Spanish in school, but I got to practice Spanish, and it was great. And so that was another good thing for me. But let's talk about you a little bit. So you are with an excellent company, and you told me a little bit about Coventry. Why don't you go through the whole thing with them, about them?
Coventry Health Care was acquired in 2012 by Aetna. Aetna is our parent company. We're very proud of that. Aetna is a company that's been in business for 160 years.
That's the big Aetna we hear about, right?
That's the big Aetna we hear.
You must be good if they decided to buy you.
Absolutely.
They wouldn't have done that casually.
Absolutely. Aetna is a very, very big company. They paid the first Medicare claims in 1966.
Oh, my heavens.
Okay.
That's when HMOs knew what that was.
Correct. We cover, actually right now, we cover 43 million members on Medicare.
Wow. 43.
Nationwide.
So Coventry is a national company.
It's a national company, and being parented by Aetna, it's even bigger. We're expanding 4 counties in Florida as we speak, opening up an office in Orlando, which will house 140 employees.
This is amazing.
And we're expanding.
But you personally are here in South Florida.
I am in South Florida. I cover the Tri-County, Dade, Broward, and Palm Beach. Myself, I live in Miami, but I travel throughout.
So all someone has to do, if they like, if they're looking for an HMO, and I know they can't do it now, they have to wait, don't they? Unless they're 65 or just turning 65,
Turning 65, right? And there's another slot that they have is if the person has Medicare and Medicaid, they can join a plan 12 months out of the year.
Excellent.
They have an open door.
Excellent.
Medicare-only patients have the open enrollment, which is coming up October 15th through December 7th.
Okay, well, that's great. Well, let me give some information out before you tell us even more. So Coventry Health Care, you can actually call Roberto. You'd like to do that. He's really very, very friendly. Roberto Bertran, call him at 305-431-3778. Again, remember, this is Pencil Talk Radio. Get your pencils out and write it down. 305-431-3778. And be sure to come over to the Boomer Expo on Tuesday at the Seminole Casino, and you will be able to talk to him personally.
Absolutely.
Okay, so tell us a little bit more about HMOs and why people should consider them.
Okay. Aetna has, and actually Coventry and Aetna, we have choices for the members. We have locally 2 plans, 2 HMO plans, and 1 PPO nationwide through Aetna. So the folks that want a guided, I call the HMO a guided healthcare plan. Why? Because you select your primary care physician, and he will guide you through your specialist, and he'll be the primary care for your health needs.
All the time?
The
same person?
The same person is going to see you.
Yeah.
He'll refer you to the appropriate specialist. And we have also a PPO for the baby boomers.
How does that
Someone
work?
that has currently a commercial plan, a PPO commercial plan, and they do not need referrals like the HMO. They want to have the same freedom that they had when they were in the workforce. We have that as well. And all of our plans are zero premium. They're no cost
Really?
to the members.
No cost.
No cost.
But they have to be 65.
They have to be 65, or if they're disabled, they can be in disability at any age, and they'll be eligible to have Medicare, and they can join a plan.
That's terrific. And it's interesting. There's a lot of competition with HMOs, but when it comes down to it, it's the way you're treated. It's the way the doctor is, just like you said. One doctor now will help you through your whole medical reviews. And so, competition is interesting. It's the same thing. Maybe there are other magazines out there too besides Boomer Times. But if you do the right thing, and of course you're very fortunate because you were purchased by this humongous company, Aetna.
Correct.
So how long have you worked for them?
I have been in the force with them for 2 years, 2.5 years.
So
I worked previously with Humana for 5.5 years.
So you've been in HM. You like this?
I've been in the system through my mom and my dad. Also, they're Medicare recipients, and I know I've been through everything. My mom unfortunately passed away due to cancer, and I went through every step of the way with the HMO that she had at the time, and they never got a bill. Everything was taken care of, even hospice. I mean, it was a beautiful thing.
Yeah, you see, people don't really understand that, and some of them are going through such turmoil because this one tells them this and this one tells them that. So if they call you, and let's say it's not exactly right for them, you'll share.
What I do, Anita, is I always put my heart in the kitchen table. What's not good for my family is not good for the member, and I'd rather walk away and not enroll a member because it's going to hurt them. I will just walk away.
Right, and you'll get a lot of referrals.
And I'll get a lot of referrals from that person.
Exactly.
And also our culture at Coventry is integrity, excellence, inspiration, and caring, most of all.
So when they hire people, that's very important to them. They have to find out what you've done and who you are.
They do an extensive background check, and they hire the correct person for the job.
It always works. It's interesting because you yourself, just as I go to places, and sometimes the people are so nice, and you say, oh, I'm coming back. And then there's some people who are either tired or had a bad day or they don't care. And it really affects that business. You don't even want to go back.
It affects, and also you have to keep in mind the seniors' attention span is very limited. So you have to make it attractive, entertaining when you're there in front of them, because you don't want to lose their attention, or else.
But the other thing that I think that just knowing you for such a short time, I think you have a lot of trust associated with you, and the biggest thing for seniors is trust.
That's the number one.
That's right. They
have to trust
believe you.
They have to believe in you, and they'll put everything on your hands.
Right. So this is a wonderful thing, and I'm talking with it's interesting because Roberto Bertran is a sales executive, Medicare, Coventry Health Care. He told us, though, that Aetna purchased them, and he lives in South Florida. So if you call him, and I'm going to give you his phone number again, no matter if you're listing in Palm Beach County, Broward, or Miami-Dade, he'll be there. And the phone number again is 305-431-3778. And you're going to be at the Boomer Expo.
Yes, I am.
And all your good looking there, and you can go. Everyone who comes, go by the Coventry Health Care booth and talk to Roberto. And I'm sure you'll be giving away all little interesting things, a lot of information.
We have all giveaways and a lot of information.
Yeah, and it's we're giving away silver dollars. This is a big silver dollar Boomer Expo. I bought about $2,000 worth of silver dollars, and we're giving them out to the veterans and to prizes great. And. So it is.
You'll be surprised, Anita. A lot of the seniors do not have a clue regarding Medicare. They don't know the rules. And that's important because if you're going to make a choice on a plan, you have to be educated enough to do that. And a lot of that's what I do. I try to educate them to make them do a wise decision as far as their health care. But I found 9 out of 10 do not know enough to make a conscious decision.
Well, one thing I think, too, with my gerontology hat on, is that people don't read well. Sometimes as they age, they may have macular degeneration, or they need to have, operations. They put them off. And so speaking is a lot more important, face-to-face speaking,
Face-to-face,
right?
absolutely.
Phones don't work so well.
No, they don't.
It's interesting.
Again, it's developing the trust
Yeah.
on the person.
I've done sensitivity training for companies like yours all over the state and for senior centers. And what I do is I teach the employees how to be really what a person in their 90s thinks, feels, sees. And it's amazing when I get finished, even the doctors come to that. They force them to come to here. They said, I didn't realize that. I didn't realize that. And that's because sometimes you can go a place and a person's on a computer, talking to the computer, the person's sitting there. And I mean, they don't hear you. They don't understand. You got to look right at them.
We've lost that personal touch.
We
as
have.
I see it.
That's happening.
With the smartphones, computers, we've lost the one-on-one, face-to-face.
With our
personal,
families, too.
With our families.
The kids, you come in, hello, Grandma, and that's it.
My kids, I prohibit them strongly to use their phones at the dinner table.
Beautiful. Yep. Yeah,
This is our quiet time, our sharing time.
Absolutely.
Once a day.
Good for you. Yeah, that's very important. When my husband recently passed away about 5 months ago, which is very hard, but we would go down. I have family down in Miami, 11-year-old triplets with my family. And they, of course, they want to do everything. They want to watch TV, and they did when they were little. But finally, my son said, okay, when we come over, especially, no TV, nothing. And we started telling stories, and we had such a great time.
I just need to look at them, and they know. TV off, phones down.
Well, but then you move that to the older adults you're dealing
Absolutely.
with. And that's the same thing that they need. A lot of them don't have anybody. They don't have their children.
Correct.
They don't have their grandchildren.
I walk into homes a lot.
They probably
that's the
touch
case.
your hand and say, please stay here and here, have some coffee. They always want to
help
give
me.
you something
You're
to eat.
my heaven sent
Yes.
angel.
Yes. And they're always going to offer you something to eat and do it. No matter what it is.
Oh, no, I always do.
Yeah.
I always do. You know why? Because that gains trust.
Yes.
Okay, and they want to feel wanted and trusted.
Yeah. Right. And and usually they like to meet with you in their kitchen or their dining room table. I mean, that's the place where all the business happens, doesn't it?
That's the one.
It's amazing.
It's amazing.
So, Roberto, you like this business, don't you?
I love it. I love what I do. Again, if it's not right for my family, it's not right for yours. Right. And that's my pet peeve.
So think about what the most important thing when you said that the older adults maybe don't understand Medicare, what would be the most important thing you think that you could tell them? Just one thing. There's so many things, but
the most important thing is look at a provider network. That's the main thing. If your doctors are there, again, our plans, we have 60,000 pharmacies throughout the U.S.
Wow.
That's a huge network.
So make sure that what you see, and that's what you would tell them this. That's when you're
you
selling
have to
this
see
them,
it in
right?
black and white in front of you. Don't get misled by phone calls.
Mm-hmm.
You have to, to make a wise and intelligent decision, you have to see it hands-on.
Good. Okay, Roberto Bertran, sales executive with Medicare Coventry Health Care. Call him at 305-431-3778, and you will see him at the Boomer Expo. Thank you, Roberto.
Thank you, Anita. It's a pleasure.